Hi, everyone. Today I want to talk about something that most men over 60 think they already know, but actually, very few truly understand. You see, a lot of my patients ask me quietly during checkups, "Doctor, is it still safe to masturbate at my age?" And honestly, that's a powerful question, because after 60, your body changes in ways you might not expect. I'm Dr. Nora, a board-certified urologist, and today I'll walk you through what really happens to your body when you masturbate after 60, the safe way to do it, and when it's time to talk to a doctor. But before we dive in, here's a surprising fact. Some studies suggest that moderate solo activity may actually help support prostate health, but only when done correctly. Sounds surprising? That's because nobody really explains the how and why behind it. So stay with me because in the next few minutes, we'll uncover how your body changes after 60, what's safe, and what's not. Let's start with what really happens to male physiology after 60. As men age, the body goes through changes that are completely natural, but often misunderstood. Around the age of 60, testosterone levels begin to slowly decline, usually about 1% each year. Now, that might sound small, but over time, it can affect energy, mood, and sexual function. Many men notice it takes a bit longer to feel aroused, or that erections aren't as firm as before. That's not failure. That's simply biology adjusting with time. What's happening inside the body is fascinating. Blood vessels in the penis become slightly less elastic, meaning blood doesn't flow as quickly as it once did. The nerves responsible for arousal also become a bit slower to respond. But here's something encouraging. Maintaining regular sexual activity, including safe solo activity, can actually help keep blood circulation active and maintain tissue health. In fact, research from places like Harvard Health and the Mayo Clinic suggests that moderate sexual activity supports prostate health and can even boost overall mood and sleep quality. It's not about how often, it's about how safely and comfortably it's done. On the flip side, some habits that worked fine at 30 or 40 might not be as gentle on the body after 60. The skin becomes thinner and blood vessels more sensitive, so rough or frequent stimulation can lead to irritation or discomfort. That's why understanding your body's new rhythm is essential. It's less about performance and more about connection and awareness. So, if you've noticed subtle changes like needing more time for arousal or less frequent urges, it doesn't mean something's wrong. It means your body is aging naturally, and it's learning a slower, more mindful pace. Coming up next, let's talk about exactly how to masturbate safely after 60, what to do, what to avoid, and how to make it a healthy, comfortable part of your life. Now that we understand how the body changes with age, let's talk about how to keep things safe, healthy, and enjoyable. Masturbation after 60 is not something to be ashamed of. It's simply another way to maintain connection with your own body and promote good circulation. The key is to do it mindfully and gently. First, take your time. The body often needs more time for arousal at this age, so there's no need to rush. Slow stimulation allows blood to flow gradually, reducing the chance of pressure spikes that can cause discomfort. Think of it less like a sprint and more like a relaxed, mindful routine. Second, always use lubrication. As men get older, skin becomes thinner and more sensitive. A water-based lubricant helps minimize friction and irritation while keeping things smooth and natural. Avoid products with harsh chemicals or fragrances. Simple and gentle options are usually best for mature skin. Third, focus on comfort, not performance. You don't need to recreate what things were like at 25. Instead, experiment with positions that feel relaxed and natural. Many men find that lying back or semi-reclining helps avoid unnecessary pressure on the lower abdomen and prostate area. The goal is ease, not intensity. Another important point, watch your environment. It might sound minor, but creating a calm, private, and safe space helps your body relax. Stress, tension, or fear of being interrupted can make arousal more difficult and less satisfying. And remember, balance is everything. Overdoing it or relying on it as a stress escape can sometimes lead to fatigue or mild soreness. Listen to your body. If you feel discomfort or irritation, take a short break. Medical studies, such as those from the Journal of Sexual Medicine, have suggested that moderate self-stimulation supports healthy sexual function and confidence as men age. The focus isn't on how much, but rather how well. Coming up next, we'll talk about something every man over 60 should know, the warning signs that mean it's time to see a doctor, and how to recognize when your body might be asking for medical attention. Even when everything seems normal, it's important to know the signs that tell you your body might need professional attention. After 60, changes in sexual health are expected, but some symptoms can indicate underlying medical issues that deserve a doctor's evaluation. Let's start with the most common one: pain or discomfort during or after ejaculation. If you experience a burning sensation, aching, or sharp pain, it may be related to inflammation or a mild infection in the prostate or urinary tract. These issues are usually treatable, but only if they're checked early by a healthcare professional. Next, notice if there's blood in the semen or urine. While this can look alarming, it's not uncommon in older men and doesn't always mean something serious, but it does require medical evaluation to rule out conditions such as prostate inflammation or small vessel irritation. Another sign is persistent difficulty with erections or sudden changes in sexual function. Occasional challenges are normal and can be caused by stress, medication, or fatigue. However, if these changes last for several months or are accompanied by pain or pelvic pressure, it's a good idea to discuss them with a urologist. You should also pay attention to urinary symptoms, such as a weak stream, the need to urinate frequently at night, or a feeling that the bladder doesn't fully empty. These could indicate an enlarged prostate or other treatable conditions that become more common with age. Remember, seeking medical help isn't a sign of weakness, it's a proactive step toward maintaining your health. Urologists see these issues every day, and early care often leads to simple, effective management. So if you're over 60 and notice consistent pain, blood, or major changes in sexual or urinary patterns, don't wait, book a consultation. The goal is prevention, not fear. In the final part of this video, we'll wrap things up with a few encouraging thoughts on how staying informed, mindful, and proactive can help you enjoy a healthy, confident life, no matter your age. Getting older doesn't mean giving up intimacy or pleasure. It simply means learning to understand your body in a new way. Masturbation after 60 can be a healthy, natural part of life when it's done safely and mindfully. The goal isn't perfection or performance, it's comfort, awareness, and balance. Your body continues to respond to care and attention at every age. Paying attention to changes, using safe techniques, and staying open with your doctor can make a huge difference in both confidence and well-being. Remember, sexual health is part of overall health. It's about how you feel physically, mentally, and emotionally. If you found this information helpful, take a moment to like this video and share it with someone who might benefit from it. It's time we talk more openly and respectfully about men's health after 60, because education and awareness can truly improve quality of life. I'm Dr. Naeem, and thank you for watching. Stay curious, stay kind to yourself, and remember, taking care of your health is one of the best investments you can make at any age. Up next, we'll be talking about simple daily habits that naturally support men's hormonal balance after 60, so make sure you subscribe and turn on notifications to catch that one.